What's going on, everyone? Happy Monday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, February 12th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID, but we talk about all the other viruses that could be a threat to your health as well, such as measles, which is where we will begin today. If you want to stay informed, maybe you didn't know COVID was still a big deal. It is. Hit that subscribe button down below, and if you learn anything and you like this video, give it a thumbs up. Let's try and get to 100 likes today. Alrighty, starting off today with measles. Yes, Maricopa County, Arizona is dealing with a measles case, which has popped up. Just one case has been confirmed, but hey, it's something that is continuing to happen across the United States and around the world. And one of the major reasons is as the pandemic started and continued, and we're still in the pandemic, there have been a lot of missed vaccinations in children. But another issue that is cropping up is weakened immune system. So the combination of the two, you do have measles starting to go around again. And there have been dozens of cases all around the country. All right, now we are leaving Arizona, and now we have to make a stop in Ridgeway, Missouri. The Ridgeway RV School District was plagued by a wave of influenza virus that had rapidly spread throughout the area, causing the school to shut down for the week. This was at the end of last week. So that is the Ridgeway School District in Missouri this time. Now let's go internationally, shall we? And let's take a look at what's going on in New Zealand. Mondays, we sometimes get the New Zealand weekly update from February 5th to February 11th. New cases, 5,878. That is up by 323. So New Zealand cases are rising. 64.77% of that are reinfections. 3,807 reinfections to be exact. Deaths did drop ever so slightly. This is good, but once again, their cases are rising again. 15 deaths. That's actually down by 5. Number of people in the hospital, 245. That is up by 23. It's sad to see because there was a time where New Zealand hardly had any cases, hardly had any deaths because they had it so well under control. They also did not allow visitors coming in from other countries at one time as well. So cases are up 5.8% compared to the previous week there. Then we have to make another international stop in Ireland this time. COVID is up by 39% in 3 weeks. Cases driven by the new JN.1 strain. 832 COVID-19 cases confirmed as infections with the JN.1 variant. To date, in Ireland, of these cases, 269, 32.3% were associated with outbreaks in hospital or healthcare settings. Yikes. And we know this is probably a vast undercount because testing is just not what it used to be, and the tests, quite frankly, are not picking up these variants all that well. I just saw someone post, forget if it was Twitter, Counter Social, I forget which one it was. There's so many. But someone posted they tested multiple times, negative, negative, negative. Then finally, like a day or two later, on a test, positive, it's COVID, all the COVID symptoms, and they said it was really bad as well. So I'm telling you, COVID, it's still a big deal. All right, since the COVID pandemic started, do you notice more people coughing than pre-COVID? We introduced this yesterday. We did this poll yesterday. I want to give you the final results. 1,134 votes. That equals to 92.2% people saying yes, and just a mere 7.8% said no. And yes, we're going to refresh this. We're going to take a look at some comments here. And you can see here, especially in the last 2 years, sometimes I cough to fit in. And then they go say, bleeping, ridiculous, no sickness since 2019. Someone says, not sure if that is because it's actually happening or I'm just more aware of someone coughing. Half of the people around me have a continuous cough since 2022, and I'm not exaggerating. I notice more people with hoarse or groggy voices. On and on it goes, yes. So a lot of people are saying that they are seeing more people coughing, and that's just because, well, there's The virus is never ending. It's constantly people sick with COVID. Then you have long COVID, where a lot of people have chronic coughing. Other illnesses are running more rampant. There's a lot of different reasons, but the point here is 92.2% out of 1,134 votes. People said they do notice more people coughing than pre-COVID. Speaking of coughing and COVID, let's look over to weekly BNO numbers. And this week they posted 234,815 new cases. The average is 265,701. That's down by 35,000. States reporting 50 out of 50. In the hospital, 19,974. In the ICU, 2,107. Both those numbers are down by a good amount. New deaths, got to get our calculator out now. 2,303 new deaths. The average is 2,457, but I can tell you this much. That total number of deaths is down from the previous week. And coming down here, we do see this is the 6th week in a row with more than 2,000 new deaths, or 14,091 deaths combined just in the last 6 weeks. That is a horrible number. There are still far too many people dying in the United States. All right, we have to take a look at this. The CDC says it's monitoring a new COVID variant with more than 30 mutations in the spike protein. BA 2.87.1 has not yet been detected in the U.S. So far, the public health risk from BA 2.87.1 appears low, according to the CDC. All right, remember those death numbers? Let's add another 1,000 to that. Let me explain. Weekly U.S. influenza update. Average new cases 2 million. Hospital admissions 20,000. New deaths 1,000. So this week, just between COVID and flu, another 3,303 deaths have been added. That's just totally ridiculous and unacceptable. Seasonal flu remains elevated but stable at the national level, with new cases at 2 million a week for 4 weeks in a row. Some parts of the country are reporting increases, particularly in the Midwest and capital regions. All right, moving on now. Let's take a look at the latest air qualities around the U.S. Here we go. And you will see here a mixed bag, but really bad today in the Mid-Atlantic, from Washington, D.C., Baltimore, up to Philadelphia. There's a little area here, patch, with numbers over 100. That is not good to see. And then looking elsewhere around the country, not all that bad, just a little bit moderate in the Great Lakes region. And on the West Coast, the usual suspects are still having issues because, after all, it is fireplace season. Look at California. Reds and oranges are showing up. If you want to learn more about the air quality and the weather, I do have another channel where I do that, and that is called Climate Data Report. There'll be a link to that down below. Today we are talking about a snowstorm that is going to be coming into the northeast U.S. tonight into tomorrow. We did one update this morning. We'll probably have to do another update this evening because there have been changes with that storm on the computer models. So if you want to learn more about that, the link to that will be just down below. All right, it is now time for the weekly Walgreens update. And this week at Walgreens, 26% positivity rate. That is down 0.8% from the prior week, which is 26.8%. Total tests, 24,630. The prior week is 26,030. You do see here that there's a lot of green. Those are places that are dropping. You also do see a fair number of states that are in orange or red or bright red, which bright red means significant positivity rises. Let's take a look at some of those bright red areas and see what's going on. Is it cases rising, or is it not enough testing? In the case of Maine, 23.6% positivity rate. That is up 8.8% from the prior week, which was 14.8%. Total tests, 55 versus 54. That's one test higher, and they do tend to go up and down a lot. And I don't think they're also testing enough. So we'll give them that. It's probably a testing issue. Taking a look at Massachusetts, however, this would also be a testing issue. 23.7% positivity this week. The prior week was 18.8%. Difference of up 4.9%. However, the testing did drop. 38 versus 48. Pennsylvania is coming up green. Let's see why they're dropping. Well, here you go. 19.6% positivity rate this week. Last week was 25.7%. That's down by 6.1%. And testing is up. 240 versus 214. So that is good to see. Also, Connecticut. Let's go back to New England for a second. Connecticut is coming up bright red. Why? Well, 25% positivity rate this week, 19.8% last week. Difference of up 5.2%. Total test, 184 versus 197. Testing did drop this week. Let's skip our way out to the plains. How about we come out to Iowa? 26.2% positivity rate this week, 12% last weekend. Wow. Up by 14.2%. Testing's also up as well. 84 versus 50. This is a legitimate case rise. Wow, and look at this chart here. Let me zoom this chart in. Yeah, rapidly going up. What's going on in Iowa? Let's go southward now. Tennessee positivity rate is 25.1% this week, 22.5% last week. Difference of up 2.6% with a significant increase in testing. 774 tests versus 565. That is a legitimate rise. All right, Nevada. We're going to look at Nevada this week and again next week. Las Vegas just had the Super Bowl. 26.9% positivity rate this week, 45% last week. Down by 18.1%. It's a pretty big drop. Total tests, 26 versus 20. So this is a legitimate drop. Oregon. Oregon this week is 26.5%. The prior week was 20.7%. Difference of up 5.8%. 49 tests versus 58. Washington. Washington 23.4% this week. Difference of down by 5.7% to 29.1% last week, and testing's down as well, 282 versus 302. What does that mean? It means it is a legitimate drop at this time, which is very good to see. Let's go even further northwest to Alaska now, and then we'll do some more states again tomorrow. Alaska, 35.3% this week. The prior week was 27.3%. Difference of up 8% with testing up as well. And that's 17 versus 11 tests. So, yeah, that's likely a legitimate rise. All right, let's take a look at just a couple wastewater sites around the country. And I think today, since we did not do much in the way of Tennessee, there were a few places we did not do yesterday. Let's include some of those places. Memphis, Tennessee is coming in with high COVID levels. And you can see here, it was dropping rapidly in January. Then it slowed, and it slowed even more. Now on the recent update, it tried to rise a little bit again. RSV was low. Now it's starting to rise again. Influenza's high, and yikes, influenza's rising again. Not just influenza A, but influenza B is also rising again as well. Norovirus is high, and that is rising again too. Some detections of hepatitis A, and none for Mpox at this time. All right, continuing on here, let's go over here to, how about we come over here to Kansas? Should we go to central Kansas? No. How about we come over near Kansas City, but the state of Kansas portion of Kansas City. And we can see here, this is Call Point, Kansas City, Kansas, and 90,000 population. Low COVID levels at this time, and not rising or dropping. It's leveled off. High levels of RSV. It does look like it's just ever so slightly rising at this time. Influenza A and B are both high, but they have stabilized, especially influenza A, and then influenza B, it's actually starting to drop a little bit. Norovirus is high and rising ever so slightly at this time. Let's do one more wastewater site. How about we go further out to the west coast, and let's take a look at what's going on in Utah. How about Salt Lake City? We'll go central Salt Lake City. Medium COVID levels at this time. Rising, it's rising a little bit once again. And RSV has been rising again. Shows here that it may be dropping a little bit on the most recent update. High levels though. Influenza A is high but dropping. Influenza B high but dropping. HMPV is dropping. Still high though. Medium norovirus, but stable at this time. And Mpox. Take a look at this. No Mpox cases detected. All right, moving on. New Jersey. Only 58 out of 70 hospitals reported today, so that is not good. The latest variant that is dominant is the JN.1 variant at 93.1%. We'll get a new update on that on Friday. Here's some good news for you. Philadelphia, EMS calls. There were only 691 of them yesterday. That is a good number. Let's do a live looking at the burbs, though. And the burbs, yeah, we're having a classic case of a busy Monday. Wow, there are a lot of calls in Montgomery County right now. It's the busiest Monday we've seen since back in mid-January. Look at this, cardiac emergency, vomiting, fracture, accident, typical episode, stroke, fever, respiratory emergency, dehydration, subject in pain, typical episode. I mean, on and on it goes. Wow. How many calls are there? 20 calls active right now. I hope it's less busy. No, it's not in Chester. Wow. Look at this. Heart problems, diabetic emergency, unresponsive person, back pain, sick person, respiratory difficulty, heart problems, diabetic emergency, heart problems, sick person. You have to start wondering. We're, on the back edge of this wave now. We're seeing all these heart problems, diabetic emergency, all these different things that are not necessarily someone that is currently sick with a virus. You have to wonder if they're post-COVID issues causing for there to be an increase in calls like this. I mean, just heart problems alone. Chester County, Pennsylvania right now has 4 calls for that. And the same deal with diabetic emergency. We do know COVID can cause new people who have not had diabetes before, it can cause it to happen. Very interesting to see. Of course, it's something we will continue to monitor. New York State today, 1,932 cases added, and the hospitalizations in New York State, they do continue to drop. They ended last week at 1,677 with 210 people in the ICU. Alrighty, folks, that does it for the Monday edition of the Pandemic Update. We will have another edition of the Pandemic Update again tomorrow afternoon. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you want to become a member of my Patreon, where you can help support the channel, help me with all the work I do here on the channel, Twitter, my website, everything I do to help keep you safe, there'll be a link in the description down below to my Patreon account. And eventually I am going to set up some sort of a chat within there so we can all, collaborate with each other to keep each other safe. Alrighty, I will see you guys all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Monday afternoon. Thanks for watching.